Really, the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hello. We're back.
We are back.
Vet Tales. Natalie Keith, Dr. Natalie Keith.
Dr. Josiah Dame. I forgot my name.
Okay, I was like, are you just messed up?
No, I was buffering.
The wheel's spinning.
The MacBook wheel.
Yes, this is what happens when you set your podcast recording time for 8 a.m. on a Wednesday.
On a Wednesday.
Yeah. Is there a better day, though?
No.
Really not. Like, Mondays would be way
Every
worse.
day. I come in buffering.
Same. My inventory manager did not tell me, but she'd set us up for a meeting with a drug rep at 8 a.m. And I was like, never again. I got to come in and get my crap together. You know, I come in a hot mess trying to figure out what's going on with my life. Like, what's the day? And they got a table set up back here I got to get to. And yeah, it was a thing.
Oh.
Anyway, but they brought donuts. So I feel like all in all, it was okay.
Fair.
Anyway, so 8 a.m. buffering. Today, we're going to talk about prostates.
Prostates.
In, like, dogs.
Yes.
Not cats.
Yes.
Or any other species. I don't know.
Yeah, sorry.
I feel like pigs or some...
Cats do have a prostate, though.
They do. They just, like, don't have problems.
I've had one cat with a prostate issue, and the funny thing is, like, it was my first year, and I was like, I think this cat has prostatitis, and one of the doctors that was working about that I love, she's a genius, but she was just like, cats don't have prostatitis. I was like, oh, I guess I was, like, thought wrong. I was like, I guess cats don't have prostates, and then, like, an hour later, I was like, no, cats have prostates.
They totally do.
They do. So that's in my head. It's always like, cats don't have prostates. They do. There are animals that.
There are, yeah. And there's like all sorts of other like glands that are happening near the prostate. That there's 3 altogether. And then there's just a mixed match hodgepodge of who has what.
Yeah.
I feel like the pig is like one of the ones that has all of them.
I don't remember.
There's a lot of pig questions on the Natalie. I just want to go out there and say that.
Yeah.
Never have I ever used any of that information since.
Pig diarrhea, don't need to know it.
Pseudorabies.
For me.
That's all I got.
I do have pseudorabies, but that's because it's a dog thing.
Yeah, right. Yeah, well, the only reason I
can of worms.
I know.
I'm going to Google pseudorabies.
Yeah, it's so fun. But the only reason I knew about it was just show pigs. You had to get them tested, sort of like Hawkins for horses. So,
yeah.
Anyway, all right, cool. So prostates in dogs specifically is what we're tackling today.
Yes.
What do you want to start with, Joe?
Well, I guess I can start with the tail, because that way it'll just work us into this. So this is my first prostate case as a veterinarian. I had a 4-year-old intact male dog present to me after being rescued because he was urinating blood. He was also heartworm positive. So on ultrasound of his abdomen, I noted that he had a very enlarged prostate and non-rectal. I noted that too. But the ultrasound allowed me to see the prostate in all of its glory, and it had like pockets of fluid throughout it also. And why it was important that it was heartworm positive is because heartworm disease, there's something called cable syndrome, and they can urinate colored urine.
Yeah, I actually have had a dog with the colored, bloody-looking urine because of cable syndrome. He lived. His name was Cash. He was a boxer. It was touch or go, do or die. We made it. Anyway, sorry.
You're good. So I was basically like, well, why is this happening? Is it the heartworms or is it the prostate? Well, once I found the cavitations, the pockets of fluid in the prostate, I was like, it's probably the prostate. So I called an internal med specialist, and he came and visited, and he poked the prostate, kind of taught me how to poke the prostate.
Changed your life.
Changed my life. And we sent that off to find out, is this something serious like cancer, or is this just benign prostatic hyperplasia, which we'll get into in a second. And thank the Lord, it came back as benign prostatic hyperplasia, and the treatment's pretty simple. Mm-hmm. So that's kind of my tale.
Yeah.
I feel like we can just jump in and start breaking down.
Yeah. What's funny is when you said we're going to start with the tail, I literally thought that you meant an actual, like you were going to start at the tail and work your way inside the dog. Like PAIL. Because like I have noticed, the reason I thought that was somewhat made sense was because I've noticed that in dogs with enlarged prostates, sometimes you can actually see a bulging where it'll push the penis backwards out. So you'll see like this little ridge line. And that can be, sort of an early indicator. It's like, I need to make sure I feel this dog's prostate.
Definitely.
So
what are the reasons why owners are coming in because of prostate issues?
Yeah, I mean, usually it depends on if it's like prostatitis or BPH, so you can get a swing of symptoms. If it's BPH, sometimes we're just finding it without there being a ton of symptoms because you're noticing those things on physical exam. And then you do your rectal and you can feel the prostate's enlarged. I think maybe this is interesting. Maybe it's just now occurring to me about how weird it is that we say this, but we call it like it feels like a Barbie butt.
This is weird for you to say it.
Yeah, I was like, because it does. Like it's about this size and so it's like got this little, yes, it's got this little groove. It should be super smooth and even. Yeah. And so you're basically checking for that. But if they're actually coming in for clinical symptoms, if it's BPH, a lot of times it's like a urinary like flow issue or the stools, they're kind of like swishing out ribbons or straining to defecate for a long time. And you're like, oh, and you're an intact male, although they don't have to be intact.
No.
If it's prostatitis, they're coming in sick, like fever. I've seen them be very, very sick from prostate disease or prostate infection.
And with, the prostatitis, they can come in with fevers. They can come in with really high neutrophil counts, basically infection cells going off, vomiting, all of it. And they can actually, in the chronic form, and probably the acute too, but in the chronic form, because they can develop those cysts that I was talking about earlier, those can rupture and cause like abdominal, like severe abdominal pain. Peritonitis. And so.
Which is just inflammation of the peritoneum, which is the lining of all the stuff in your abdomen. Yeah. I mean, they basically, and they'll be every bit as sick as a female dog with a pyometra, which would be like a uterine infection, because it's the same mechanism of action where we have this abscess in an internal organ, just wreaking havoc systemically.
Exactly.
So, so just depending, those are kind of like, especially in the intact males, it's a little higher on the radar when you have a sick dog and or you're seeing those urination or defecation issues. And so then we do a rectal exam, or like that does seem big. Some dogs you can't feel because they're so big. Like once you get past about 45 pounds, like I'm out.
Yeah. I mean, you can't even feel a normal prostate sometimes.
Exactly.
So, and when they get larger, they enter the abdominal cavity.
Yeah, they'll like drop down in front of the pelvis, and you can't.
You can't. So, X-rays and ultrasound are going to allow us to actually visualize them, because on X-ray you can see a large prostate. And again, that might be normal if the dog's not, clinical and they're intact. But it kind of slips right under the bladder.
It does.
Which you could totally visualize how it affects urinations and defecations just due to the location. But then ultrasound is so nice because that's when you can like say, oh, there's cavities in here. And this looks a little bit more concerning than just like benign prostatic hyperplasia or BPH. And then obviously you add your clinical signs to what you're seeing visually.
Absolutely. Yeah, that makes me think of Pickles.
Yes.
Pickles was like a
90 pound.
Yeah. Like Dobie-ish.
Dobie May.
Yeah. And he presented for, he was definitely an interesting guy, but a super sweet dog. It's been some time ago now, but he presented for urinary obstruction. And I don't remember exactly what the original ER vet thought was going on, but then it turned out it was just like.
I think they originally said stones, and then we did the ultrasound. And
we were like, oh my gosh, this prostate
is huge.
Yeah.
Can't remember. Did I poke that one or I'm not sure.
I'm not sure either, but I do believe it ended up being cancer in the prostate in that particular region.
I don't know how we got there, but we got there because there's a couple ways to diagnose,
distinguish
between cancers, benign prostatic hyperplasia, which falls into prostatitis, because you can get a combination of both.
I mean, you could technically have prostatitis in a cancer as well. So, I mean, so they can be, so you're either going to have cancer or benign, and then you can have prostatitis that is neither BPH nor cancer, or it could be either of those.
Because all prostatitis is an infection. Usually it's a retrograde infection, meaning it's going up the urethra into the prostate, and then it hangs out there because the prostate's encapsulated. So it's really
tough. Like a dead end. It's like the cul-de-sac.
Yeah, exactly. So it's really tough to, one, locate the bacteria that's causing the issue, two, penetrate the prostate with your antibiotics, and then three, clear it. So chronic prostatitis is actually pretty common. So chronic infection of the prostate. But when we are, we've done our imaging, we've decided that the prostate's enlarged, then we're going to go, okay, is this cancer or is this benign?
Right.
A benign process. You can do a traumatic catheterization, and you can sometimes find out what type of cancer it is through that, because you can exfoliate or pull away cancer cells from like the prostate urethral lining and maybe get an answer with that. And that's also how you can culture the urine and the discharge from the prostate and see if you can figure out what kind of bacteria you're dealing with. Mm-hmm. So definitely with prostatitis cases, they recommend to culture. And then the kind of third option is to do a fine needle aspiration of the prostate, which is where you pass a needle into the prostate via ultrasound guided aspiration. You poke around, you put it onto a slide, you send it off to a pathologist, and you say, what is it?
Yeah. And you could also culture that way too.
Yeah.
You could pull back, aspirate, and which I feel like I would if I were going to pick a method, that would be the way, as opposed to traumatic catheterization.
That's frustrating because like you don't always get the bacteria from that, and you're like, I know this dog has prostatitis, but nothing on it.
I mean, even just for the dog's sake, like that's less uncomfortable. It's just like a backwards vaccine, not a big deal.
Yep.
There's just saying traumatic catheterization makes me want to just be like, no, thank you.
I know.
No, thank you. There's got to be a better answer.
Poking it.
It
sounds crazier.
Yeah. I mean, it does sound crazier, but it really isn't. It's just a backwards vaccine.
Most dogs handle it so well. Mm-hmm. It's shocking how well they handle it. And I have gotten diagnoses of prostate cancer and benign prostatic hyperplasia from doing that.
We just had Blue in for neuter yesterday because he got diagnosed with BPH. Well, it was prostatitis. Yeah. But it was benign. He did not have cancer.
Yep.
So, so that's part of the treatment plan too. So if it's just BPH, like straight up, then you just neuter him, put him on some NSAIDs, give him a hot second.
Yeah.
And then if it is prostatitis, then you've got another layer where we're talking about antibiotics for depending
minimum 4 weeks.
Extended period of time. We were just talking about this morning. There's some recommendations for that, like so Baytril or enrofloxacin was the first one.
And then there's some bacteria, like we talked about, there's some antibiotics that just don't even get into the prostate. So you have a list of the ones you can use.
Yeah, like clindamycin's one we use a lot.
Clindamycin's when we use. TMS is when we use. Chloramphenicol, we're not going to use.
Oh gosh, chloramphenicol. Because it can cause a non-regenerative anemia that's permanent in humans.
So we just stay away from that as much as possible unless you have a culture to back it up. But the best empirical choice antibiotic is enrofloxacin. Empirical meaning like a medical educated guess.
But the downside is that if a lot of these dogs are big dogs, and Baytril or enrofloxacin proper is so expensive. It's so expensive. Now you can use ciprofloxacin as a substitute for that, but there are some questions on bioavailability, meaning like essentially one dog may only need, 5 mg per kg, and the other dog may need 20 mg per kg to reach the same blood concentration. So there's a downside there, but it's dirt cheap. So, and I find that I'm actually pretty successful with this. So
that's good.
I mean, I don't use it a ton for prostates, but like for, let's say, like rods in the ear.
Yeah.
Or things like that.
Yeah.
So anyway.
So antibiotic treatment, neuter.
Yes.
If the dog is, stressed upside down, when we do the little prostate aspiration, we usually do it when they're upside down, on their back,
They lay in a little squishy trough.
Squishy trough, and they're comfortable. But if the dog's like, I can't do this, and they look at us and say, I can't do this.
I can't do this today. No.
Then I go, okay, we will start an antibiotic, typically start an anti-inflammatory to help with any inflammation of the urethra and prostate that's going on to help kind of shrink it a little bit. And then we'll just neuter them. And at the time of neuter, I will poke it because might as well, not do multiple anesthetic events just to poke a prostate and then find out 4 days later that it, was benign. And then we're like, oh, we have to neuter it now.
And then have to go back and sedate the dog again.
It's just like, let's neuter them. And then most of the time, it's not a scenario where the owner needs them intact.
Yeah. So let's talk about that I feel like I'm bouncing a bit, but I don't want to lose these thoughts. Some dogs, when you say owners don't need them intact, neutering your dog can greatly reduce BPH. And in fact, my recommendation that I've made for years and years is that if you have a breeding dog, I would still neuter them when they turn 7.
Yes.
Because by over the age of 7, something like 95% of dogs at some point will acquire varying levels of BPH.
Yes.
And so it's just, why not?
It's frustrating for the owner because it's usually a chronic thing that's going on. And then they're like, what is going on?
And the longer that happens, the higher your chance of developing neoplasia or cancer within the prostate. And it's just like...
And there's other...
They don't need to be breeding after 7 anyway.
Yeah. There's other testosterone-related tumors. Like you can get perirectal tumors that are testosterone-related.
Yeah.
Just a lot of things. And it's just at that point, it's time, or when you're just done breeding them, it's probably time to neuter them. It also is not like an instant fix when you neuter them. So it'll take, I tell people all the time, I'm like, see me back in 6 weeks, unless but if you're still seeing blood in the urine over the next 4 to 6 weeks, that's to be expected. It's not going to immediately regress. Yeah. But I mean, obviously, if there's issues, you need to come back. But don't be shocked if you see clinical signs. So it's definitely something that's not a quick fix.
Yeah, the hormones have to regulate. Yeah.
If it is a breeding dog, you cannot neuter them because you need to breed them, and it has a BPH kind of issue. There is an oral medication called finasteride that's used to kind of reduce one of the hormones and help kind of settle it down. That is probably just a Band-Aid, though.
Yeah.
Until you can either, collect semen and then store it.
Yeah.
Kind of prepare for the castration that's kind of coming.
Yeah.
Yeah.
Yeah. Yeah. And you got to do the full-on castration. You can't do the chemical neutering thing because that's when people talk about chemical neutering, they'll do injections to sterilize the dog. You're just really sterilizing them. But you're not decreasing any of the hormones.
Oh, I didn't know that.
Yeah.
That's interesting.
Yeah. So you're still going to have all of those male-driven behaviors. So, the tendency to get out and roam, to look for a female, territorialism, aggression between other males, hiking, and prostate enlargement. So, I mean, the fact that you didn't know that makes me I'm actively questioning myself, but I feel like I'm 98% sure.
Into.
Well, yeah. Well, we had a clinic in town that used to do a lot of them, and I ran into a lot of problems with it. So
yeah, it sounds like that would lead to a couple problems.
Well, one of the reasons people want to do it is because they know that when we neuter, that sometimes we can drop in metabolism.
Yes.
And so you have to be more careful. It's not that neutering a dog makes them fat. It's that neutering a dog and overfeeding them makes them fat. And so you have to stop overfeeding. You have to be more careful about how much they're eating. It's just like all of us when we weren't in our 20s anymore. And so it's a thing. And so people like to do the chemical neutering so that they would still have, that higher metabolism and so forth. But then it's but the con on that is that everything else is still there too. So
exactly.
Yeah. So I'm going to Google it while you talk about something else.
But the kind of most extreme thing that you're going to see with the prostatic enlargement, just in general, so through prostatitis, through BPH, or through cancer, is going to be a urinary blockage. That's going to be the most touch and go scenario anytime that we have prostate enlargement. So if that is the case, a lot of these steps are going to be kind of pushed forward and streamlined. So we're probably going to neuter much quicker. We're not going to just wait around. We will probably be passing a urinary catheter to try to relieve the bladder and give relief until kind of that swelling comes down. We're going to be probably culturing the urine potentially, starting antibiotics, et cetera, to really just ramp up treatment as quick as possible, because urinary blockages are fatal. I mean, if you don't get them unblocked, if you don't get it settled down, it's going to be fatal. So you have to work relatively quickly.
Okay, so first of all, just to circle back, I would recommend all of you not to ever Google this, because there's a lot of really horrible things that pop up that are not about. Anyway, so anyway, so it actually depends on the type of chemical castration you use, and it can decrease hormone, like testosterone, which is driving prostate size, for 6 to 12 months. Blah blah blah.
Yeah.
So it does have some impact on it, but I still feel like just neuter the dog.
Yeah.
Full on.
Yeah. You still have the cells there. So
exactly. Okay. Sorry.
No.
Okay.
That was really informative.
Yeah. I mean, there was a lot more information there, but it was getting a little dicey. Yeah. Just want to say on record that I don't know a ton about chemical castration in dogs.
They don't teach it in school very much.
They don't.
At all, actually.
Yeah. And I feel like there's reasons for that.
The biggest reason I remember them, because it was like touched on, but the biggest reason was it creates a public issue because you can't visualize that the animal is castrated.
Right. And so like all these stray dogs or whatever, like, because that actually happened to us as well. So there was a cat that had been chemically castrated, and an owner found it, and then it was like, so it still visually looks to be intact. And so we go to do the neuter, and it's like it changed the morphology of the testicle. And I was like, what is happening, bro? And then at some point, somehow it comes like full circle. Like maybe she didn't find the cat, but then rescued it from somebody. And she's like, what is going on? And then it came about that the cat actually had been chemically castrated, that there was a history of it. And so this cat went through an unnecessary neutering procedure because that it looked to be intact.
That was a big thing that they told us in school. It was just visually, it doesn't answer people's questions quickly enough if the dog can reproduce.
Right.
And you need to know that.
I mean, yeah, because population control is huge, especially in Oklahoma. Like, I don't know, like Colorado has much better population control, but here it just, yeah.
Yep.
Just like Bob Barker, spay and neuter your pets. Please.
Yes.
Anyway, okay. So where are we at in our process? I lost my place.
We actually wrapped it up.
Cool. Great. So, and you talked about they can do chemo and radiation.
Oh, no.
Okay. Because I checked out totally mostly while I was researching. So, yeah. So let's just say we do the aspirin and
the most common cancer is going to be carcinoma.
But it could be other things, right?
Yes.
So so it could be other things. So you got to figure out what kind of cancer is there to know what your options are. But essentially, we don't do prostatectomies. I mean, is there another syllable?
Prostatectomy.
Prostate.
We don't do those here.
No, they can be done, but they're extremely rare.
Yep.
I don't even know where they do them at.
I mean, I am sure that like Dr. Dugat could do them.
You think?
But by the time you find prostatic carcinomas,
it's usually everywhere.
It's usually metastasized.
Yeah. So chemo and radiation are options if we want to refer for an oncology thing. Otherwise, you're still kind of just like neuter and meds for support.
Yep. Usually it's neuter, carprofen, or Duramax.
And if you're getting secondary prostatitis, you're going to manage that. And then you just wait and see what happens. But unfortunately, prostate cancer in dogs is a much different story.
Yes. And I typically, when they come in clinical and I diagnose with an aspirate, which takes about 3 to 5 days, usually about 4 weeks later, owners are bringing them in due to either some difficulty urinating or a blockage, or just they're like declining.
Yeah, that was Pickle's situation. It was just like we were having to catheterize him
every day.
He had to stay. Yeah, otherwise he could not get urine out.
And so,
and eventually it's just started making him feel really bad.
Yeah, and then I had one last summer too that basically just started to waste. And during that 4 week period, and the owner was like, "Okay, I see it happening now." So they opted for you.
Yeah, so usually it's a quality of life your problem within a pretty short period of time.
But 90% of the time, it's benign prostatic hyperplasia.
Mm-hmm.
I will say most.
Yeah. You know, I think Comet had. Yeah, no, I'm lying. He had anal gland carcinoma, not prostate. Never mind. But he did chemo and did really well for about a year. But that was anal gland, not prostate.
I have a friend that has hunting German short hair pointers, and he brought him in because he was having trouble pooping and in this benign prostatic hyperplasia, and thank the Lord. And we just had to push him. And like a week later, he was like, he's normal.
Yeah. Ta-da!
Yay. And he was 7. So he didn't.
Yeah.
He didn't need it anymore.
Yeah, honestly.
Yeah.
Yeah. So I think that's basically it. You know, just in your males, watch for straining to urinate or defecate or blood in the urine. We will image to confirm a suspicious prostate situation, aspirate if needed, medicate as warranted.
Or if they're not utilizing them, schedule a neuter.
Yeah, like if you currently have an intact male even if they're young, like even if you got a 2-year-old intact male and you don't intend to breed them, like they're just say goodbye. Like I know that there's like some human emotional component to this because I hear it all the time, but your docs just don't have any of that going on in their heads. They're not going to feel deprived. They're not going to feel like less of a man or whatever. Just neuter them so that they'll stay healthier.
Yes.
Okay. He's laughing hysterically at me, and I'm not really sure at what point I stepped out of line, but
you didn't.
Okay.
It's just funny.
It is funny, humans. Okay. And they're dogs. All right, cool. Is there anything else?
No.
Okay.
I hope this was educational.
Yeah.
I hope you never have to have a dog that deals with this because it's long and frustrating sometimes.
Yeah. Maybe next time we'll talk about anal glands.
Anal glands or pyometra. Because I pair prostatitis and pyometra together.
Yeah. I mean, yes. Now that we're talking about it, yeah. Absolutely. Okay. All right. Cool. I hope y'all have a wonderful rest of your day. Enjoy, and we'll see you next time.
Bye, guys.
Bye.